So for drawer test is a case of example of anterior drawer positive with ACL rupture. So since this limb is immobile, we will not we won't be able to flex that. But ideally, how do you want to do the anterior drawer test? You flex the knee, okay, but below less than 90 degrees, flexion to be less than 90, you have to flex both knees. As I said, we are not able to do it there. So ideally, flex both knees, and the first thing before you sit, you have to look for posterior sag sign. Okay, so I inspect laterally, I look for posterior sag. How will I look for posterior sag sign? When I inspect laterally, I have to make sure that the tibial tuberosity of both knee is on the same level. If there's a drooping, it means there's posterior sag sign positive. Why is it important for me to rule out posterior sag sign before sitting? So let's say this is the tibia and this is the femur, right? Anterior cruciate ligament prevents the anterior translation, excessive translation of the tibia anteriorly. So if there is an posterior cruciate ligament prevents the posterior translation of the tibia. So there's already a posterior cruciate ligament rupture. The tibia will be at a lower plane from its neutral position. So for example, let's say this is a neutral position, the tibia will be positioned lower. So when I'm going to sit and I'm going to pull the tibia, if I don't rule out posterior sag sign, I will misinterpret the translation as a positive anterior drawer test. But anterior drawer test positive means from neutral it must translate anteriorly, not translating it to neutral position from already a fallen position. So I'll look for posterior sag sign. Then what do I do? Okay, then I have to sit on the forefoot. Okay, I will sit on her forefoot and I will make sure that the hamstrings are relaxed. It is to stabilize the patient, and I palpate, put the thumb on the joint line, and I fully extend the elbow and I move my shoulder. So you can see this is a translation. So I should try not to flex the elbow. Fully extend and use your body weight. So how do you use your body weight? Just with the extended elbow, just move the shoulder behind. Okay, like this. Okay. And then this is anterior drawer test. When I go posteriorly, when I give a posterior transit, posterior drawer test positive. Okay, so I can feel an anterior but you should compare both sides and measure. Okay, you have to see the translation on both sides. Okay, okay, an example of drawer test positive. So another test to look for anterior cruciate ligament rupture will be Lachman test. You should also know. So the question is, if I can already do anterior drawer test, why would I want to do Lachman test to confirm an anterior cruciate ligament rupture? That's because Lachman test is more sensitive. What do we mean by sensitivity? If a test is more sensitive, means it will give a lesser false negative result. The incidence of false negative will be lesser. So Lachman, how do I do? Two ways. If you can contain the entire diameter of the thigh with your grip, then you can do in this method. So just flex about 30 degrees, grip, and thumb on the tibia. The remaining fingers grab the calf, and so this is what I'm going to do. The common mistake is you rotate. Do not rotate. It should be, this is to stabilize the femur, and I'm just giving an anterior translate. This is what I'm doing. I'm not rotating. I'm not extending and flexing the knee. I am giving a translation. So this is what I grab the femur, then I just give a, see, you can see. If I'm not able to contain the thigh within the grip of my palm, then I use my thigh and make sure that the patient's thigh rests on my thigh, like this, okay? Then I stabilize and I do the same thing. Okay, so that concludes the test.